Good evening, everyone. We can formally start this webinar now. A warm welcome to you all on behalf of Association of Pakistani Cardiologists UK. APC UK was formed almost 2 years ago by young cardiologists of Pakistani heritage who have been working in the UK. Aim of APC UK is to promote educational activities. During the last 1 year, we have arranged many medical webinars for doctors. However, this is the first event where we are trying to help young students who are interested to study medicine in the UK. It's also very unique. We're trying to help parents as well who want to guide their children how to go medicine. Indeed, to get admission to medical school in UK is challenging and universities assess applicants vigorously. However, smart preparation can increase your chances considerably. I hope you will find this course useful and educational. I am Dr. Ahmed Shoaib, who is a consultant cardiologist and hosting this session. We have a very good team today. But before starting this session, I would like to do some housekeeping rules. Please make sure that your microphone is on mute unless you have a question. Please submit your question in the chat box. We are expecting a large number of audience today, and it may be not possible. We can take the questions through microphone. It's better if you write the question in the chat box and we will pick those questions. We will give the answer at the end. A link will be provided at the end of webinar for feedback. There will be a QR code and you can either copy the link into your browser and just scan QR code with your smartphone. Certificates will only be emailed to those who completed the feedback. Link also will be shared in the chat. The link will not be available after the meeting. Now I'm introducing our first speaker who will guide you why we need to study medicine. Taha Bhatt is a fourth-year medical student in University of Newcastle, and he formed a YouTube channel where he can guide the young how to enter in the medical schools. We are very fortunate such enthusiastic speaker is present among us today. Taha, you can start now, please. Taha, you can share your screen, please. Taha, can you unmute, please, yourself? I think so, Taha, this is your second presentation. Taha, we can't hear you.
Hello, Assalamualaikum. Can you hear me?
Yeah, we can hear you now, Taha.
Okay.
Good.
Sorry about the delay. I wasn't able to turn my microphone on. But Assalamualaikum, guys. Hello, welcome. My name is Taha Bhatt. I'm a fourth-year medical student studying at Newcastle Medical School, and also make YouTube videos on the side as well. So just aimed at medical student prospects such as yourself, giving tips on how to get into medicine, and also giving people an insight what it's like being a medical student as well through blogs as well. So the first talk that we're going to do is why medicine? Why would someone want to actually study medicine? Well, I just want to first start off with this. Medicine is like an ocean. And I still remember I was coming back from a flight from Thailand where I did my World Challenge expedition. And I was sitting with a complete stranger. I wasn't sitting with my friends, but this complete stranger turned out to be a neurosurgeon working in Australia. And I asked him for advice for medicine. And he said, medicine is like an ocean. It's so vast, you can't know everything in its full depth because it's so big. But because it's so vast, it accommodates to all different personalities. So guys, I don't want anyone here sitting here today in a Zoom meeting to think there's not a place for me in medicine. Medicine fits all different personalities with its all different specialities. So just to give you guys some examples, some of the surgeons I met, well, all doctors are amazing, and some of the surgeons I met are amazing, but their personality is described as quite quick, quite sort of rash and blunt, because they're in it for the quick fix. They don't really have time to like talk to the patient and get to know them fully. They just want to cut the patient open, get the problem out, and then fix them. As opposed to, say, GPs who take more time to talk to their patients, to try and build up that relationship as well. And they have to tend to the patient's emotional needs using their empathy and communication skills, as well as tending to their biological needs as well. You've got people like pediatrics who deal with children. I remember on my pediatric block, I was actually observing a pediatric consultant who took 40 minutes to try and take blood from this 2-year-old child. And I'd never seen so much patience displayed by a doctor before. I could never do that, but yeah. And don't think as well that for medicine, that it's necessary that you have to be good with people. Although throughout medical school, you have to have good communication skills to pass your OSCEs and to make it easier on the wards. But there's a place for you as well if you prefer working in labs. Say you can work as a pathologist as well, or you can work as a radiologist as well, who are people who interpret chest x-rays and other various scans rather than dealing with people. So that's one reason why you'd want to study medicine. It fits so many different personalities. Another reason is that it's a rewarding profession. Guys, if we just think as well, what does being a doctor mean, and what does it actually entail? Well, essentially, you're saving lives. You're helping to improve the health of so many people. A patient, when they come to hospital, they're coming to the doctor very vulnerable. They tell the doctor things that they would never tell the closest people in their life. So they're very vulnerable. And as the doctor, you have such a, the honor to be able to have a huge direct impact on that patient's life. You have the honor of being able to improve that patient's health and sometimes save that person's life. And that's what makes medicine so rewarding and satisfying. And the doctors here today will confirm as well that a lot of the patients will show a lot of appreciation and respect to you as well if you fix them and help them as well. And this is a quote I've included on the screen as well. So at the time, I met with the professor and I was quite unsure of what my ideal career was. So I asked this professor, how do I know what my ideal career would be, what my dream job would be? And the professor said, you want to choose a profession that is challenging and rewarding. And medicine is definitely those two, challenging and rewarding. Exciting. So I've talked about a bit about being a doctor and it being so rewarding, but what about as a medical student? Well, I'm entering my 4th year of medicine, but as in my 3rd year of medicine, I got to observe C-sections, cesarean sections, and natural births during my obs and gynae block of placement. And this was the most, if you don't know what a C-section is, just in simple terms, they take a pregnant mother and rather than giving birth naturally, they cut the mother's tummy open, they cut the womb open and deliver the baby that way. So they take the baby out that way. And as a 3rd year medical student, I got the opportunity to not only assist in that surgery, but I was the first person to actually pick the baby up and dry it off. So even as a medical student, it's so exciting. I mean, how many people on other courses will get those types of opportunities? I don't think many others. So it's absolutely amazing to see that. Slightly, not as much on a positive note, but still as exciting and intense. You might get the opportunity to see some cardiac arrest and emergency scenarios. So for example, even as a medical student, as a third-year medical student, my friend got to perform CPR on a patient. And another one of my friends, they actually got to use a defibrillator on a patient as well. So very intense and very exciting situations you can find yourself in as a medical student. Psychiatry hospital. So me, myself personally, I really enjoyed my mental health block of being a medical student. So we got the opportunity to learn at a psychiatry hospital where we dealt with patients with all sorts of different mental health disorders, such as sort of suicidal tendencies, bipolar, delirium, psychosis. And it just opened my eyes to another whole side of medicine. I think often people are under the impression that health is sort of only just the biological aspect, you know, having chest pain or coming to the doctor for a cough. But we sort of ignore this whole other mental side of medicine, where it's tending to a patient's sort of depression or mental health needs as well. So that for me was very exciting and eye-opening. And the excitement and learning doesn't stop at medical school. Even as a doctor as well, you still are learning constantly. And you know, the doctors here again today, they will confirm this as well. They still have to keep up to date on their knowledge by reading the NICE guidelines, reading research papers that might come out with new medicines that they can use on their own patients as well. So medicine is an ever advancing field, which makes it so exciting because we've seen how far it's progressed in the last, 10, 20 years, with the news of robotic surgery and AI medicine and the medicines itself. So I think that, along with medicine being a rewarding profession and it being able to accommodate all different personalities, I think those are some of the reasons why someone would want to study medicine and what makes medicine such an exciting profession to be part of. And thank you very much. That concludes my Why Medicine talk. Over to you, Dr. Shahib.
Thank you very much. Next speaker is Ahsan Khan. He's a cardiology registrar at ST4 working in City Hospital. Ahsan did GCSE and A-level from London Medicine, from University of Leeds with 10 distinctions. He did foundation and core medical training in the West Midland. He will deliver a talk on GCSE and A-levels. Thank you, Ahsan. You can share your slide, please.
Thank you, Dr. Shoaib. Assalamu alaikum, everyone. So I will be touching on what subjects to choose for your A-levels. So John Dewey, a famous American philosopher, said that education is not preparation for life, education is life itself. I hope that from Taha's amazing talk that you all have decided that you want to do medicine, so that's a great start. A-level subjects are one of the key elements of preparation, and not just for admission to medical school, but also for a career in medicine. I still use what I learned in maths, biology, and chemistry in GCSEs and A-levels during my day-to-day job as a hospital doctor. Preparation is key to get into medicine. Medicine degree is highly competitive, and most medical schools require at least AAB at A-levels. So just a word on GCSEs. There is now, as most of you will be aware of, a new grading structure used in England where the old alpha, so A star to U, have been changed to numerical grading from 9 again to 1. So just be wary of that because some universities will now specify the new grading structure in their entry requirements. So as a minimum, you need 6 A stars to be, or in the numerical new grading system, 9 to 5, including chemistry and biology or double sciences as your GCSEs, plus English, language, and mathematics. If you are in Scotland and you're doing Scottish Highers, then you need 2 A's and 3 B's at high level. If you are in Ireland and doing Irish Highers, then you need 2 A's and 4 B's, including chemistry, biology, and maths. If you are doing IB, which is getting more popular, the oral score is 34 points, including 3 high-level subjects at minimum of grade 5, one of which must be chemistry or biology. Now, these are very generic requirements here. I would urge you all that you go into the specific university's entry requirements because they will have the most up-to-date information. William Osler, a very famous Canadian physician, is known as the father of physician in Canada, said that the best preparation for tomorrow is to do today's work superbly well. So you want to give yourself the best possible chance to study medicine. If you want to study, then it's crucial that you pick the right A levels. Also, make sure that your A levels lineup keeps your options open when it comes to applying to medical schools. Entry requirements by medical schools do vary, but chemistry is essential. And like me, when I was at your state, having done my GCSEs and was doing my A levels, I was wondering, why is chemistry so essential for medicine? Surely it has to be biology. The reason is that we as doctors use oxygen, we prescribe oxygen to patients who have difficulty in breathing. We often give nitric oxide for patients in pain, especially in labor. So there is use of chemistry there. We prescribe fluids if they have a low blood pressure. So sodium chloride, it's a chemical compound. So that's where chemistry comes into play. And of course, majority of the medicine that we prescribe, if not all, are actually chemical compounds. So that is why chemistry is the essential, the most important subject to do and required to do medicine in UK. So a lot of universities also require biology. And the reason for that is, well, we study about the DNA structure, which is quite important when it comes to doing medicine. We study about the different organs, the heart, the vascular system, the brain, the nervous system, etc. So it's quite important. And we also learn about the cell differentiation with mitosis, etc. So that's quite useful when it comes to doing medical medicine in medical school. And why mass is important? Because we use a lot of measurements, such as height and weight, we use in our daily practice as a doctor. And you use obviously microscope when you're doing research. And in research, you need to use formulas to come up to power calculation in terms of how many patients you need in your study to get some meaningful results. So mass comes there. And obviously the drugs that prescribe, some need to be mixed with other solutions, and nurses use their math skills to be able to come up to the right concentration of the drug. So which subjects to choose for your A levels then? Well, as I said, chemistry is a must. A good combination is biology. It is mandatory for some universities in addition to chemistry. You can also do maths, but a word of caution that only one of the two, either maths or further maths, will be accepted, not both. You can do maths and further maths, but they'll only take one of the grades. And then obviously physics is also a useful one, but it can be anything else. I did geography in my levels and it was great fun. Plus I got an A. So it's the means to the end in order to get into medicine. Chemistry is a must, as mentioned before. Other must-have depend on the university that you want to go to, but it makes sense to assume that you'll need to have studied at least another science. So here's a good idea of what I think might work. Chemistry, biology, and either maths or physics, or ideally both if you can, and keep all the medical schools open to you. If you don't take maths or physics, but you do decide to take chemistry and biology, it will keep open the vast majority of the universities. If you don't take biology, but do take chemistry and either maths or physics, then there are some medical schools that will accept you. So always check that the entry requirements for your university, or the one that you want to go to before you apply using UCAS. You generally have to achieve the highest grades to study medicine. An example, University of Birmingham, again, do check their website for the most up-to-date information. They require 3 A's at A level, including chemistry and biology A level, or predicted 3 A's at A level. If you're doing Scottish Highers, then they want 5 A's. And if you're doing advanced higher, then they want 2 A's and a B, including in chemistry and biology. For University of Cambridge, they will require 2 A stars and an A at A level, and applicants must have either A level pass in chemistry and 2 of either biology or physics or mathematics. The success rate for students offering 3 or more sciences in mathematics A levels has often been higher than those without, but you do have some exceptions. So Lancaster University is another university where each applicant it's generally what they say is considering their own merits. The offers usually are in the range of to students who have got either 3As, B, or 1A star and 2As, including biology and chemistry at A level. Leeds University, where I went, they want 3As in A levels. And if you're flying via access to Leeds, then they would require you to have A and 2Bs. And there's specific subjects that they require at those grades. And University College London, their standard conditional offer will be grades 1A star and 2As to include chemistry and biology. And they also offer the Access UCL scheme as well. So some tips from myself. Sadly, entry to medical school is very competitive and it is only going to get worse. Having 3A to A star at A levels, at A2 especially, including chemistry and biology, should secure you an interview. Should be smart about your A-level choices. You should choose subjects that you have an interest in, and that will give you the grades you want. Chemistry is a must. If you don't like maths or physics or biology, it's not the end of the world. Thank you. I'll finish here.
Thank you, Ahsan. It's a great talk. Our next speaker is Fatma Ahmed. She is a second-year medical student, University of Birmingham. She will talk about her volunteering and work experience. She applied for 4 medical schools and got admission in all 4 medical schools, got offer for all 4 medical schools. She's quite good in work experience and volunteering, and especially in the interviews as well. Fatma, can you please start your presentation?
Yes, can you please let me start my video? Okay, so hello everyone. Thank you for that introduction, Dr. Schwabe. And I'll just jump right in. So today I'll be talking about work experience and volunteering. So first of all, why do you need these two? Well, firstly, work experience and volunteering helps you to become well-rounded individuals. Universities are looking for people who are not just academically smart, but who also are compassionate and empathetic and have contributed to the community. Second, it helps you to gain insight into your chosen career. So universities want to know that as a doctor that there are benefits of working as a doctor, but there are also challenges that come along with it. And you have weighed up both the pros and cons and then made an informed decision. Thirdly, it helps you to develop essential skills like teamwork. So to be a good doctor, you need to be able to work as a team. You need to be able to communicate well with your patients and your colleagues, and also have good problem solving skills and take responsibility for your actions. And all of these skills you can develop during your work placements or your volunteering. Fourthly, it helps you to prepare for personal statements and interviews. I know we will be touching on personal statements later on, but just to mention it briefly, it's to write a personal statement, you're reflecting on all of the experiences that you've had and what you've learned from it, and why would those experiences make you a good doctor. And in order to have some experiences, you need to actually do some volunteering and work experience. And lastly, it helps you to gain experience of working in a care setting. So again, that links to that, you know, what a being doctor is like in real life, not just what you see on shows like Grey's Anatomy, but the actual realities of working as a doctor. So I've mentioned some opportunities that you can do in person. Obviously, I know because of COVID-19, it can be a bit difficult to secure places, but it's always good to just call places up and ask them if they're offering any volunteering or work experience in person right now, because I know a few places are doing it. So in a hospital, you can shadow clinical staff, or you can also volunteer in a ward. So when you're shadowing a clinical staff, you can possibly shadow a consultant or a junior doctor and see how they interact with patients and how they communicate with them and how they work as a team and what their daily life is like. Or if you volunteer in a hospital ward, that's where you actually are interacting with patients yourself. So for example, I did volunteering in both an oncology ward and also a pediatrics ward in a hospital. And the role depends on which ward you volunteer in. So in oncology ward, because I was working with adults, I would make tea for them or coffee and really just have a chat with them. Whereas with kids, I would play with them, offer them some arts and craft activities, organize a little bit of events. And the main part is that you're making the experience for patients a little bit better. You can also do some work experience in primary care. So you can get some placement in a GP surgery or in a walk-in centre. I know that's really difficult from experience to get it, because for reasons like the fact that you may know some of the patients, and GPs are really wary of having people come in and knowing the patient that, you know, like you may know it and you may get to know some more personal details about them. So I'll be offering an alternative in the next slide. Or you can even do some work experience in a pharmacy or in a dental practice. When people think of medicine, they think, oh, you need to do work experience in a hospital, but that's not necessarily true, because as a pharmacist and as a dentist, you'll also need to have those communication skills or those teamwork skills, and those skills are transferable to when you work as a doctor. And plus, a lot of people who apply for medicine put pharmacy down as a fifth option on their UCAS form. And then it's good to have on your personal statement that you've also had a pharmacy placement. Or you can volunteer in the community, so care homes, hospices, homeless shelters. Again, because of COVID, I know it's a bit difficult, but with care homes, for example, you can just call them up and ask if they have any Zoom volunteering going on. Or if they don't have an opportunity, why don't start it yourself? Why don't you offer that you may do a bingo night with some of the residents once a week on Zoom? And that could be a really good way to interact with people and contribute to your community. Or you could also volunteer as part of NHS Volunteer Responders or as part of St John's Ambulance. So NHS Volunteer Responders, this is a new scheme that's set by the NHS, and the NHS needs volunteers to help administer the COVID-19 vaccination. So you'll be helping people, helping them guide to the right place and answering any of their questions. So that's a good way of volunteering. Or in St John's Ambulance, a lot of volunteering options that I mentioned in here, you have to be over 16. But with St John's Ambulance, if you're 11 to 16, they can teach you first aid. And then you also have the opportunity to volunteer at events and teach first aid to other people. So in the next slide, I'll be talking about some online opportunities. So these are opportunities that I researched myself. Obviously, there's a lot more out there, and you can type into Google work experience, virtual work experience, and I'm sure loads of results will come up, but this is something that I'm mentioning in this course. So firstly, University Hospital Birmingham did a virtual course last year for students, and I think around 4,000 students attended, and they took you through a patient's journey from primary care to secondary care to tertiary care, and you got to see how the patient's journey progressed, and you also had the opportunity to ask questions to the clinicians present. So again, that's a really good alternative to having a work experience in a ward if you can't get it in person. Second is Observe GP. So this is another work placement opportunity, and that's the one that's an alternative to working in a GP in real life. So Observe GP is basically set up by RCGP, which is an organization that all GPs are part of. And what Observe GP allows you to do is that there's a lot of videos that you can watch that take you through the role of a primary healthcare team. So they'll take you through the role of a GP as well as a practice manager or a receptionist and a nurse. So you actually get to see a lot more of the GP surgery than you may have had the chance to if you were doing it in person. And they also have a lot of scenario questions on, for example, if this patient came up and asked this question, how would you as a doctor deal with it? And then a GP actually takes you through the answers. So again, that could help you with in future with interview prep as well. And then the third opportunity that I mentioned on this slide is Medic Mentor. This is similar to University Hospital Birmingham, as in this as well, they take you through a patient's journey through primary care to secondary care to tertiary care. However, Medic Mentor is not just a day placement, it takes place over 6 months. So you do it, you do 6 meetings, I think, for 6 months. So once a month you have a meeting, and it adds up to around 42 hours. So again, that's as many hours as you would have done if you were having a work experience placement in a hospital for a week. And at the end, you also get a certificate. So again, this is a really good alternative if you can't get it in person. The last one is Kissing It Better, which is a volunteering organization. So before, they used to work with schools, and you were allowed to go into wards and interact with elderly patients there and read them a story or play some cards with them, again, just to make the experience in the hospital a little bit better. But because of COVID, obviously, these are some of the most vulnerable people and we don't want to be putting them at risk. So they've taken the organization online. So instead, through Zoom, you can talk with residents in care homes and really get to know them, and they may be feeling a little bit lonely and they haven't had the chance to interact with their families, but you can be providing that companionship and that really building a good relationship with these people. Next, I've talked about some paid experience that you can do in healthcare. So paid experience is usually recommended if you are working, if you're taking a gap year, because in school, usually paid experience you can only get when you're over 18 anyway, or if in school you do get the opportunity to, you need to really focus on your grades at the start. But in your gap year, universities expect that you have done something, and usually a job is a way to show that you've done something worthwhile. And if you can get it in the NHS, that's even better. So you can work as a healthcare assistant, helping patients change their dressings or taking them to the toilet, etc. Or you can work as a medical administrator, as a receptionist, or even maybe as a secretary to a consultant, as a porter as well in hospitals. So taking patients to their appointments in different departments, or delivering equipment, or even as a pharmacy assistant. So pharmacy assistants, sometimes you need extra qualifications. You need to have had done this qualification, but there are a lot of pharmacies that allow you to start at starting level as well. So as long as you have got good communication skills, they allow you to work towards that qualification as well. So these are some of the things that you can do in your gap year. Now I'm going to be talking about the Duke of Edinburgh Award. So this is awards that most students do who are applying to study medicine. It's, again, not mandatory. None of the things I've mentioned in this PowerPoint are mandatory, but it's something that makes you stand out your application a little bit more. So with Duke of Edinburgh, it's offered to 14 to 24 years old, and there are 3 levels, bronze, silver and gold. You don't necessarily have to do like bronze to jump to silver. I jumped to silver straight away. I didn't do bronze, or even you can jump to gold straight away. And there are 4 components for each of the levels. So you need to have to complete a physical section where maybe you've done an activity like running. You need to have to learn a new skill. So I did, for example, photography. You need to be able to volunteer at an organization. And then there's an expedition part as well, in which you take part in camping, and it takes place over 2 to 3 days, and you camp with your group that you're with, and you walk to different destinations, and also cook by yourself and set up your own tents. And that's basically all of these components you need to do to be able to complete the award. And Duke of Edinburgh has to be done for a certain amount of time. So for example, to complete bronze, you need to have to do 2 components for at least 3 months and 1 for 6 months. So for example, you could do physical and your skills for 3 months and volunteering for 6 months in order to complete it. The purpose of Duke of Edinburgh is basically that you learn lots of new skills. You learn those skills like teamwork, communication, which I've already mentioned. And that's why a lot of people put it on their personal statement. For example, I put it on my personal statement to talk about teamwork, that we had an incident where one of our members couldn't carry her rucksack and we all carried it in turns. And that showed me, that allowed us to develop our teamwork skills. And as a doctor, you'll be happy to work with a lot of different people as well. NCS is another extracurricular that you can do. It's similar to Duke of Edinburgh, except it takes less time to complete it. So it's for 16 to 17 years old, and it's usually completed in year 11. And instead of Duke of Edinburgh, which takes months to complete, it's only held over 3 weeks. So in the first week, you have the physical section where you learn, you do a lot of physical activities like rock climbing or canoeing. Then second week, you have residential, where you live with a group of students in a university accommodation, you cook for yourself, you build relations with each other, you live that independent life. And your third week is community. So this is when you design a project with your group where you are going to contribute to your community a little bit. So for example, you can go and volunteer in a care home, or maybe you can paint the walls in a nursery. So this is again something that students do to build up their skills, but also to have fun. So Duke of Edinburgh versus NCS, a lot of people ask which one they should do. You can do both of them, you can do neither of them, it doesn't matter. It really depends on what you are as a person. Like I said, a lot of medical students do end up doing one or the other. So Duke of Edinburgh, the pros are that it shows consistency, because you have to complete components for a certain amount of time. You need to show that you were consistent and that you stuck with what you wanted to do. And it also allows you to develop long-term skills. So that skill, like cooking, you're developing it over, for example, 3 to 6 months. A con of Duke of Edinburgh is that it takes a long time to complete. Another one is that it may be expensive. So it usually depends on your school, because school have their own admin charges. And because people usually do it with their schools, it can end up being a little bit more expensive than what NCS would be. You can do it outside of school, but I don't think a lot of people do it. But that's always an opportunity that you can use. With NCS, it's more affordable. So you have to pay £50, which is a little bit more affordable than what Duke of Edinburgh would be. However, I know when they promote their events, it can go down to between £30 to £35. And that's because NCS is actually funded by the government. So the government actually pays for most of your experience. Another pro is that it takes really little time to complete it compared to Duke of Edinburgh. NCS is only 3 weeks long. So it may be less physically demanding, but you're not able to show consistency. You're not able to show that you were able to stick to something for that long period of time. And you can only complete it in year 11 or early year 12. It's usually held in year 11 summer, and then you may be able to do it in your year 12 autumn holidays in your half term. So if you miss the chance, then usually you can't do it. Whereas with Duke of Edinburgh, you have until you're 24 to complete it. So next slide, I've got some useful sites which you can use to find those work experience opportunities, or to find those volunteering opportunities. So NHS England Volunteering, NHS Volunteer Responders, Step Into NHS, Royal Volunteer Service, and NHS Jobs. These are all places that you can use to look up volunteering opportunities, and also work experience opportunities as well. The best thing to do is call up individual organisations, or to email them and ask if they're offering anything. And you can do that through Find NHS Services Near You. So this is a site where you can find hospitals that are near you, or GP surgeries or care homes, and get their contact details as well. So you can start contacting them. So just a tip before I finish, start early. If you haven't done any work experience or volunteering, start now, because this is the time where everyone is going to be trying to get stuff sorted. And because of COVID, that in real life opportunities, they'll be limiting places. So start early, start contacting people, and don't be disheartened if you don't get it at the first go, because it can be really, really difficult to find, but keep at it. And there's so many different things that you can do. It doesn't matter that if you don't have an opportunity in the hospital itself, you can still learn the same things while volunteering in a care home. So I hope this was useful. Thank you for listening, and that's it for my talk.
Thank you very much, Fatma. There are a lot of questions on the chat box, and it may not be possible to answer all the questions. Secondly, this webinar is focused who are studying here in UK. We are unable to answer the question regarding international students. We may arrange a different seminar in future to address those questions. Our next speaker is Raheel Ahmed. It's a pleasure to introduce Raheel. Raheel is a founder member of APC UK. He did GCSE and A-levels from Newcastle and received one of the top 5 marks in UK for GCSE English language in 2007. It's really remarkable. It's after few years he came to UK. He came to UK, I think, so in year 8, and he was top student at the GCSE. He did medicine from Newcastle University and did core medical training from West Midland. Currently, he's a cardiology ST5 registrar, and he's going out of program in next few months for his MD in Royal Brompton Hospital. He will talk about UCAT and BMAT, which is one of the most important component if you want to apply for medicine. Welcome, Raheel.
Thank you very much, Dr. Amachare, for such a lovely introduction. Can everyone see my slides okay? Is that okay, Dr. Shoaib? Can you see?
Yeah, Raheel, we can see. You can yeah, it's good.
Great. Thank you very much. So yeah, my name is Raheel. I'm a cardiology registrar working in the Northern Deanery, going out of program soon next month to start in London. I'll be delivering 2 talks back to back. It will be on the entrance exam requirements, mainly the university clinical aptitude test and the BMAT. So the first up, we'll talk about UCAT. So the contents of this presentation will mainly focus on, First of all, which universities consider UCAT examination, and then we'll go step by step into each of the 5 components of this IQ test. Essentially, that's what I believe it is. And we'll discuss some of the top tips as we go along. So without further ado, here's the UCAT university. So we can see that roughly there is around 30 medical universities which are looking at UCAT examination. So it is one of the most important parts of your medicine application. And if you're thinking of applying to any of these universities, then it is quite important that you do quite well in this examination. And therefore, a good preparation is necessary. So first section is on verbal reasoning. It has 11 passages, and each passage has 4 questions associated with it. It is extremely pressured on time because there are 21 minutes and you have to answer 44 questions. So 11 passages times 4 questions essentially gives you 44 questions in total, and you have to do that in 21 minutes. Now, a strategy you have to think of your own, but what I would recommend is that you should try and do all the 4 questions of one passage in less than 2 minutes. Because if you do that, then you can at least have a good go at 42 questions in 21 minutes, if not 44. It is probably not possible to finish all of them to the best of your abilities within the time frame. But some of the techniques you have to do are you have to try and improve your ability to read quickly. So I would encourage you to read sort of things like newspapers, medical journals, even non-medical journals, and try and see if you can pick up techniques to try and increase your speed, to try and get the gist of the message and therefore be able to answer the questions subsequently for each of those passages. So there's 2 types of verbal reasoning questions. The first ones are those which will have a passage followed by a statement. And the question will say, according to the passage, is this statement true, false, or can't tell? And then there's a other type of questions, which are the longer type questions. We'll go over each of those 2 in a minute. But an example that I can think of straight away from my head would be that if the question says, and if for example, the statement says Neil Armstrong went to the moon. Now, this is something you know Neil Armstrong was the first man to go to the moon. But did the passage say that? Did the passage say that Neil Armstrong went to the moon? Is the passage even about the moon? Is the message even about Neil Armstrong? So if the passage has got no mention of Neil Armstrong going to the moon, then you will have to say it is can't tell according to the passage. So this is checking your comprehension skills. And essentially, you have to bypass and leave behind all your existing knowledge to one side and just read the passage, pick up some keywords from the statement that you've been given, scan it in the passage, see if it's there. And if it's there, you say it's true. If something is completely different from what is written in the statement, you have to say this is a false statement according to the passage. And if there is no mention of that, or it is not easily derived from the passage, you have to say it's can't tell. So here are some of the tips in addition to the one that I've already mentioned. So know the different type of questions, the true, false, can't tells, and the longer type of questions. Have a strategy in your head of how you're going to approach the 2 different types of questions. Know some common tricks, try and come up with some of your own, and try and avoid any mistakes along the way. We've already kind of touched upon what true and false actually mean and what can't tell means. Try and be careful about negative questions. Sometimes there may be a statement saying something like, this is not according to the passage. So you have to be very careful that if it says this is not according to the passage, then and it is not in the passage, then the statement becomes true. So previously, if you had not picked up the negative word, which is the not, you might have think, okay, this is a false answer, which in your head is absolutely correct, but actually will give you the wrong answer. And beware of any definitive words, things like this is always true, this is never true. So these statements, I, for one, for example, usually think that if there is a definitive word in the statement, that answer is usually false. Now, please don't quote me on that, but this is what I've picked up on. So if it is a definitive statement, try and see if that definitive word is definitely in the passage. It probably won't be, but if there is, then of course it's true. But if there's a definitive statement, more often than not, it is usually not the right answer. Try and not use your external knowledge, as we've already touched upon, and practice increasing your speed. Make sure you can really improve your speed in the next few weeks. I know that the UCAT exam is right around the corner for some of you, and most people try and do it in September. So if you are the one, you probably need at least good 6 weeks to try and prepare for the UCAT, I would say. Some more tips I would say is make sure you read the statement first. Try and scan some of the keywords in those passages and try and pick it up there. Other people suggest you should read the passage completely quite quickly and then have a go at answering the 4 questions. Like I said, one passage, 2 minutes. Try and aim for that. And some questions will take longer than the others. So if there is a huge passage or if there is a big statement and you are, thinking, okay, I'm not too confident, I'm going to be very quick at answering these questions, the strategy I can suggest to you is try and make some estimated guesses and flag these questions. So, there's an option on the UCAT website, which is that, you click an answer, flag, next. Like, do that. Maybe do that for the 4 questions of that passage, and try and have a go at the easier questions first, passages which are smaller, statements which are smaller, maybe have a go at them first. So hypothetically speaking, if you aim to get 25 answers completely correct, I'm just sort of saying, and the next 20 you've guessed, there's a good chance that at least, 50 to 70% of the guesses will even be correct. So if you've had a good go at the 50% and you know that you'll get them right, imagine that you've got 32, 33 questions correct out of the 44 that you've been told to do. That's a really good score at the end of it that you'll get for verbal reasoning. So you have to be very smart in your choice of answering these questions. I hope that makes sense with the use of the flag and guess method. So flag, guess any difficult question, but obviously don't flag everything and go at the end, because basically you would have guessed everything. So you have to be very careful with these things. Try and have a go at all the UCAT questions that you can find on the official website. That's one thing I would suggest. Trust your instincts. If you've chosen an answer, don't just stay on that question for too long. Just move on, try and answer the whole thing first. That should be a priority, and then go at the end and answer the questions you flagged as you went along. So here's an example question. We won't go into very much detail of this question because I don't think I've been given enough time to solve this question right in front of you to explain to you what it is. But here's one of the examples of the longer type of questions you'll see in UCAT, and I've just basically print screened it from the official website. So what I would do in this question is I would have a quick read of the statement. It says, which of the following can be deducted from the passage? And the option A is nylon is stronger than polypropylene, which is stronger than blah, blah. Polyester is more elastic than nylon. Double-braided ropes are stronger than Indian hemp is stronger than wet than nylon, etc., etc. So, and then there is a passage on the side. Now, if you are one of those people who are quite good at reading these type of questions, so these are the harder type of questions in verbal reasoning that I personally find. I think the true, false, can't tell are probably the easy ones. Number one, there's a 33% chance you'll guess them correctly. Here you only have a 25% chance. If you've not read the question, if you've not had a go at answering the question, and you're completely estimating and guessing and moving on, there's a 25% chance. So I personally would do all the true and false can't tell questions first, and then go back and do these ones if I was you. But if you do want to have a go at it, you need to read this passage quite quickly. You will find that the correct answer in this case was A, and it was A because the second paragraph and the third paragraph tell you that that polypropylene is not as strong as nylon, and then it goes into details of the other ones. So these are the harder type of questions. Again, if you use some of the tricks and tips that I've mentioned, hopefully you'll get the answer right. Here's the other type of question. So this is whereby you have to go at the true, false, can't tell type of questions. So have a quick read of the question. It says, if I convert 50 pounds into equivalent number of US dollars, I will be able to buy the same basket of groceries in the USA as I originally purchased in the UK. Is this statement true, false, or can't tell? Well, have a quick read of the passage. I'm not going to read the passage, but try and scan. What exactly are you scanning? There's a 50 pound, which I think is quite relevant. That should be one of your keywords. There is US dollars, there is basket of groceries, and there's UK. So try and see if you can pick any of those. Okay, so the correct answer is can't tell, because prices can differ greatly in different countries, and the passage says nothing about the purchasing power. So if I go back at the question, like I said to you, if there is no mention of that particular word or statement, which there isn't, so if you do read this and you'll find out that there is absolutely no mention of this, then of the purchasing power, then you have to say it's can't tell. If that statement was there, it would have been true. If something else was completely written, then it would have been false. Moving on, next section is on decision making. Here you are probably not as time pressured as you were in verbal reasoning. You have 29 questions and you have to answer them in 31 minutes. So you can say to yourself, you have probably a minute per question, and try and see if you can do it that way. If you're taking, if you've taken 90 seconds already at a question, I think it's probably about time you would guess, flag it, and move on. So the same technique applies here, but it's not as pressured as verbal reasoning was. And there are different types of questions in decision making. So some questions will have 4 answer options, but only one of them will be correct. The other type of questions will have 5 subsections, and you have to put a yes or no next to them. And I think they are probably the easier type of questions to get right. So again, if you think that you would like to do these first, you're more than welcome to, but try and have a go at the whole of decision-making. There is no reason why you should not be able to attempt the whole examination in time. Here are some of the words it should be very clear in your head what the meanings of these words are. So always means like, it's the thing on the tin. It is always. You cannot have sometimes. It should be always. Majority means more than 50% of the whole population that you're talking about. Some, on the other hand, does not mean that, etc., etc. So some of the decision-making tips. Understand what the decision-making is testing. It goes without saying, you have to make sure you practice lots and lots of these questions. I do believe decision-making, like quantitative reasoning, is one of those things you can improve on. And you can improve on with good preparation, because there is an element of some mathematics to do with it. You may have some questions with graphs. And if you're good and comfortable with graphs, you can score quite highly in these questions. There is some probability as well. So if you are good with understanding and interpreting probability, you probably would score quite highly. We've talked about some of the key words you've looked at. So here's a question in that other kind of category whereby you've been given 5 statements and you have to put a yes or no next to them after reading the passage. So I'll read it quite quickly. Employees are promoted on the strength of their performance rating. A company rates all its employees between 1 and 4 for their bonus allocation, 1 being the highest, 4 being the lowest. Employees are only eligible for promotion after 3 years of service in the same position. All employees and those eligible for promotion must get a rating of 1 or 2 for a bonus payment. So place a yes or no next to these statements. Diana got a rating of 4 this year, so she will not receive a bonus payment. Now then, is this a yes or a no? So we know that if you get a 4, you do not get a bonus. You can only get a bonus with a score of 1 or 2. So if she got a rating of 4, she will not receive a bonus statement. So that is yes, because be careful of the negative word there. You see there's a not receive a bonus payment. So that is a yes. Brian was promoted 3 years ago, so it is definite that he will be promoted this year. Well, there is no mention that if you were promoted 3 years ago, you will get a promotion this year. So this is a no, because you have to be rated 1 or 2, remember that. So it is a no. Roger was promoted 5 years ago. He received a bonus this year. He did not get a rating. He did not get a 3 rating this year. This is true, because if he did not get, well, wait a minute. So if he had received a 3, he would not have got a bonus. But he did not get a 3 rating this year. That must be true, because if he had received a 3, he would not have received a bonus. In other words, his rating must be 1 or 2. Salim got a promotion after working for 2 years, so he cannot be working for the company. That is true, because the statement above, if you read, it says employees are only eligible for promotion after 3 years of service. So if he's only worked for 2 years, he would not have got the promotion. So that is yes. The number of employees at the company who receive a promotion each year is higher than the number of employees that do not receive a promotion. Well, there is no mention of that, so we have to say no. Does that make sense? So this is the rationale given for those answers. But I think this is one of the easier type of questions. It's a small passage, just a couple of 1.5 lines, and you only have to answer yes or no. So you have to make decisions, but quite quickly. Do you think you would be able to answer this question in 1 minute? I think it's doable. I think it is doable, definitely. Try and read that statement maybe in 25, 30 seconds. Quickly understand what it's trying to say and try and have a go at these 5 yeses and nos in the next 30 seconds. And as they say, Bob's your uncle. Right, moving on. So here's another question. Now, this is probably one of the harder questions. And if you think that this is a question that will take a lot of time, if I was you, I would guess, flag, and move on and try and have a go at one of the easier answers first. And once I've completed all the easier answers, I would then go over all the flag ones by clicking the review flag questions. So a very difficult question. I won't go into as much detail, but what you need to do in these type of questions is you probably have a whiteboard in front of you. Try and make a quick table and see if you can make some sense out of it. So it's 5 tourists from different countries, China, Italy, Germany, France, and America, wore shirts, hats of different colors. And there's about 5 different colors there. So what you have to do is you have to make a quick table with the nationalities on one side, color of the shirts on the other, and the color of the hats on the third one. And as you read the paragraph, start filling in the box. So the American was this, the Chinese was this, the French was this, the German was this, the Italian was this, the color of the shirts was so and so, the color of the hats was so and so, or that's the possibilities. And by the end of it, you will come up with the answer. And the answer in this case was D. Which of the following statements is true? The Chinese tourist wore a blue or brown shirt. If you look at that table and if you've been drawing it correctly as you go along, you will see that the second category is talking about the Chinese individual and that statement comes out to be true, all the other ones were false. But like I said to you, it's quite hard, I think, to do this question in 1 minute. But if you're good at reading, if you are good at your decision making, you should be able to do it. But it's making that table, which was quite essential, essentially. Right. Moving on to the third one, quantitative reasoning. I think this is the section that people, or I for one, did the best at. And it's probably because Dr. Shoaib mentioned that I did my primary education from Pakistan. Our maths is usually quite good back home. So essentially, if you are struggling with this section, I would encourage you to try and wipe off some of the dirt and dust of your GCSE mathematics book and start reading it. There is a good section on probability, ratios, bar charts, graphs, and all those grade C level mathematics work, you know, the foundation stuff of GCSE, which I think you should be good at. If you can master those skills, you should be able to have a good crack at quantitative reasoning. There are 24 minutes and you have to answer 36 questions, which means you have roughly 40 seconds per question. So make sure you are good with your mental mathematics. Now, there are certain things that I think you can learn and do quite quickly. So how do you time something by 10? Try and not take out a calculator for everything, even though you do get given a calculator for this examination. But if you know that times by 10 basically means add a 0 to your number, then you should be able to do that in your head. How do you divide something by 2? It's the same as, you know, you just half it. How do you times something by 5? You would put a 0 next to it and then half it. In other words, you're timesing it by 10 first and then you're halving it. How do you time something by 4? That is the same as double it and double it again. How do you time something by 8? It's double, double, double. So if you can double 3 times, that's the same as timesing by 8. So have some tips and tricks up your sleeve to try and answer some of these questions. Be good at estimation. So if you've got a question and 4 answers or 3 of them are completely different from one of them, and you know that the answer is roughly 1,000, then the answer is probably 990 and not 2090, if you know what I mean. Read the question first and carefully, and don't be fooled by the unit changes. So again, this is something you can practice and learn. So you should know that 100 centimeters are there in a meter. You should know that there are 12 inches in a foot, etc., etc. Right. Some more tips. Don't get flustered. Write down important information on the board that you've been given. Practice quantitative reasoning. With practice, you can improve your score in this one. This is probably the section you can score the highest with practice. Learn how to use the calculator. Now, there are some computer shortcuts which you can use to try and avoid clicking and using the mouse every time. I would encourage you to learn those. Now, I don't have them on the top of me, but I do know that, for example, CTRL plus P stands for something. CTRL plus S stands for something. So if you can know what each of those individual keyboard functions mean, that can help you answer these questions quickly. You should know how to go from one page to the next page without using a mouse. You can just use your keyboard. So if you are quite savvy with your computer skills, you probably would be able to score quite highly in your quantitative reasoning and practice under time pressure, I would say. So here's a question. The table shows the total tax paid in dollars on annual taxable income. Now you can clearly see that the left side is your income, the middle section is the percentage tax rate, and the right-hand side is just giving you the total for the maximum within that category. So if you earned 8,950, 10% of that basically means divided by 10. So knock off the 0 off the end, it's $895. And then from 8,950 to 36,250, it's 15%. So you should have a technique in your head. 15% is the same as divided by 100 times it by 15. 36,000 to so and so is 25%. 25% means divided by 4. 28% you probably can't do in your head, which is the same as 0 times by 0.28. 33 you can still do, probably it's divided by 3, etc., etc. Anyways, the question says, for example, a person with an annual taxable income of $60,000 will pay 4,990 plus 25% of the income between 60,000 and 36,250. So if the question is, Bill has an annual taxable income of $28,950, to the nearest dollar, the income tax he has to pay is what? Right, have a quick look at the table. Up to 8,950 is $895. So it means you are in the second category and you have to calculate 20,000 of 15%. So what would you do? 20,000 divided by 100 gives you what? It gives you around 1%, okay? And then you would times it by 15 to get your answer. So 20,000 divided by 100 is 200. 200 times by 15 means times it by 10 and then times it by half and add them together. So 200 times 10 is 2000. Add another 1000 is 3000. 3000 plus 895 is 3895. The correct answer is B. I have not used the calculator. You will be able to answer this question without using the calculator if you've got some arithmetic mental math skills that you can use very handily here. So the answer is B in this scenario, and you go on and do the next question, etc. Try and do them in 40 seconds each if you can. Here's another question. The graph shows the velocity of two cars at different times. So it's checking your ability to understand a velocity time graph. The question says, how much greater is the acceleration of car A than the acceleration of car B? You know that acceleration is the same as velocity divided by time. In other words, acceleration is the gradient of this graph. So car A has traveled 16 meters per second in a straight linear line in 4 seconds. So the acceleration is 16 divided by 4, which is 4. Car B is going constantly with a velocity of 8. Its acceleration is 0. So 4 take away 0 is 4. The answer is A. You can move on to the next question, and so on and so forth. So you get the idea. You should try and do as much of this using your mental maths, and this is something you can prepare for. Abstract reasoning is the next section. This is probably the one with the most time pressure, and the one I must admit I did the worst on. So 55 questions, and you have 13 minutes to do it. Now, there are about 11 passages, each with 5 questions on them. And probably if you should aim in your head that I need to do all of those 5 questions in a minute. So what I would say to you is, in abstract reasoning, what you have is you've got some figures in set A, you've got some figures in set B. You need to pick up the underlying theme in set A and pick up the underlying theme in set B, which is exactly opposite from the underlying theme in set A. And once you've done that, you can then have a go at answering some of those questions. Now we've got a question coming up. It says from Jash Khan, will we be allowed a physical calculator in the exam? No, it is not a physical calculator. It is a calculator on your computer screen, and you should be able to go to the UCAT website and start using it and be able to understand how to use a calculator. Extremely important. With the BMAT examination, you do not have a calculator at all. In this one, you have a computer one, and it is a non-scientific calculator. So if you are practicing, try and practice on your computer screen using the calculator that is there on the UCAT website. Try not to use your own calculators in your own hand, because if you become too comfortable with them, you will struggle in the actual exam. Anyways, coming back onto the abstract reasoning questions. So like I said to you, you will have 6 figures in set A, you will have 6 figures in set B. You need to pick up the underlying themes in set A and the underlying theme, which is different in set B, and come up with your own answer. Let me just come up with a silly question. So here's probably what you see. Say, for example, all the shapes in set A are curves like circle, oval, etc. And then if I was to say to you set B, all the shapes are things like rectangle, triangle. So you've picked it up, haven't you? Set A basically has curved lines. Set B has straight lines. Now, if I was to say to you, here's a question. This is a semicircle like this. So will it go in set A, will it go in set B, or will it go in neither? You say to yourself, hang on a second, there is a curvy bit and there is a straight bit. If it's got both, surely it cannot go in A or B. So the answer will be neither. Now, this is a very easy example. The examples or the themes that there will be in the actual abstract reasoning may be much harder, but it could be as easy as that. So you need to have a system in your head of picking up the themes in the first 30 seconds at maximum, and then have a go at the next 5 subsequent questions within the 30 seconds. If you can do that, you've answered 5 questions on the same theme in 1 minute, and you should be able to get done in 11 minutes. I know it's hard, but you've got 13 minutes. So you know what I'm trying to say. So the different type of questions is the set A, set B, or neither is only the one type of question. Then you will have a series of shapes in the type B questions, and you will be asked to select the next shape in the series. Then there's a third type of question in abstract reasoning where you will be presented with a statement involving a group of shapes, and you will be asked to determine which shape completes the statement. The type 4 is where you will be presented with 2 sets of shapes labeled A and B. You will be asked to select one of the 4 response options that belong to set A or B. I'm not going to go over each of them, but here's some examples. Sorry, can you see my slides okay? So here's some patterns. So make sure number, shape, color, arrangement. Those are some of the themes that could be present. Try and see if you can remember some of them. You need to pick up your own sort of patterns and mnemonics in your head of how to do them. So color, shapes, pattern of the shapes, the size of the shapes, the symmetry, the alignment, the ratio of the shapes. These are all some of the themes that may underline set A and set B. Have your own mnemonic. CPR is one, which could stand for the C, could be for common and color, position, rotation, or orientation. SCORN is another one that people use, which is symmetry, color, order, not there, extras. Here's an example. So look at set A, look at set B. Give yourself 30 seconds to see if you can pick up a theme. Right. So what do you see? I can see there is some squares and there's a line through them. And then there's some white circles attached to them. Then there is a black circle, which is just hanging around there. Oh my God, what is this? Oh, I'm not sure. I'm not sure. What is this? Okay, right. Let's see. So what is really happening is, if you look at set A, let's focus on the first one on the top left-hand side, where there's a black square. When that is present, the next subsequent square's line rotates clockwise by 90 degrees. And you can see that that is something which is there in all of them. The next shape down, where there's a black square, the line rotates by 90 degrees clockwise, and it does so again. In set B, on the other hand, when there is a black square present, this line within the square rotates 90 degrees anti-clockwise. So that is the underlying theme there. Very hard to pick, but if you've got that abstract reasoning, you should be able to pick it. Now, look at that test shape. When that first black square was present, the shape rotates 90 degrees anti-clockwise. And with the second square, it again rotates 90 degrees anti-clockwise, and then it stays that way. So because it's anti-clockwise, it is set B. Oops, apologies. No, it is rotating not clockwise, it is rotating, sorry, it is not rotating anti-clockwise, it is rotating clockwise. So it is actually set A. Moving on, next one, situational judgment. So here you have 26 minutes to answer 69 questions, and there are 22 scenarios. Now, this is something which you should try and do to the best of your abilities. Try and not pick up answers which you would do in the scenario. Let me try and explain myself. You should do what you should really do in these scenarios. So there is a should do and what you would do. The answer that you should pick is what you should do in the real scenario. And just remember one thing in your head. Patient safety takes priority over everything else in life as a doctor. So if you hear something, if you see something, if you notice a mistake, if you think at any point something is endangering patient safety, then that needs to be the priority. Whether that means you need to report somebody, whether that means you need to pick up, the skin of a banana off a floor, you need to do that. Whether there is anything else, you need to ensure patient safety is a priority. So you will need to rate the importance and appropriateness of a series of statements, and that's what you should be doing. So hey, some of the tips are: read good medical practice. It goes without saying. If you just Google good medical practice, it is freely available online. Have a read of it completely, because that will tell you the principles underlining the life of a medical student and a doctor, which is honesty, integrity, justice, autonomy, beneficence, non-maleficence, justice, amongst many, many other principles, which we should be practicing on a daily basis, and understand what the answers mean. So rate the responses, not the scenario, and make sure you know what your role is. There are certain things you are limited by which you cannot do. So make sure you know what they are and use your instinct with some of these answers. So here's a question. The question is the potential risk of infection that the liquid presents to the patient in the hospital. So again, I would read the statement first, then I would go back and read the passage. So what is the passage? Marin is a medical student, is walking through the hospital corridor when she sees a small pool of liquid in the middle of the floor. She is already 5 minutes late for the start of a shift, however, does not want to leave without cleaning it up. Marin must decide how to deal with the situation. How important take into account are the following considerations for Marin when deciding how to respond to the situation? So let's go back to the question. The potential risk that infection of the liquid presents to patients in the hospital. Is it very important? Is it important? Is it of minor importance? Is it not important at all? I said to you, patient safety takes priority over everything. So this is very important, and you should go with very important for this answer. You probably in real life, I'm not saying you should, but you probably in real life, if you were running 5 minutes late, you would probably tell somebody, can you quickly clean this up? I'm rushing to the lecture and I'm running late. If I run late, I'm not going to be able to get my sector, blah, 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 blah. But no, that's not what you're going to do. You should clean it yourself. So
Right.
that's UCAT for you. Is that okay, Dr. Shoaib? So the UCAT is done. Is everyone with me so far, or am I other people losing interest before I go over BMAT?
I think so. So we have a mixed bag audience, and what I am getting a feedback, students really like it, but some parents actually feeling that it's too much for them. But it's a great presentation, Rahil. It's really wonderful. It's really wonderful. Students giving a great feedback, and probably they are suggesting that we need to arrange a separate UCAT and BMAT score with where
No
they
problem.
can
More
get
than happy to do that. But because we are sort of pressured for time, I'm trying to sort of hurry, and I do apologize for hurrying. But you know,
No,
there's a lot to
it's a
cover, and I
great,
think
it's a great talk. It's a great
yeah,
talk.
and I think going over the minute details is probably not possible given the
Yeah, you're
scarcity
right.
of time I've been given. But I'll try and do justice as much as possible. Right.
Okay.
So BMAT examination. Now, BMAT examination will go over the same things, some of the tips, some of the contents, and which universities look at it. So it's got 3 sections as opposed to UCAT, which had 5 sections. The 3 sections are section 1, thinking skills. That's more IQ, but can be prepared. Section number 2, scientific knowledge and applications. And number 3, the writing task. We will go over all 3. First of all, these are the universities that have BMAT as their entrance examination. And these are your big dogs. It's Cambridge, Oxford, Imperial College London, UCL, Leeds, Brighton and Sussex, Lancaster University. Keele University do not require BMAT for the home students, but it does require it for the overseas applicants. I don't know why. Right. So the first section is thinking skills. Now, you can already see from the first 2 bullet points that this is a section which is not as time pressured as UCAT was. It has 32 MCQs and you have 60 minutes to do this section. In other words, you literally have got a couple of minutes to do a question each, and it's only an MCQ. So it should be easily done if you think about it. If you practice laws, you should be able to do this. The 32 MCQs are subsequently divided into 2 sections, the 16 problem solving and the 16 critical thinking questions. So each of those sections have then further divided into the relevant section, the finding procedures, identifying similarities. And the problem solving does require mathematical knowledge. So if you are good at maths, you should be able to get 16 out of 16. Critical thinking is more sort of your understanding of the English language. Can you identify the main conclusion? Can you draw a conclusion? Do you know what an assumption is? Can you assess the impact of that statement? Can you detect some of the errors? Can you match the arguments, etc., etc.? Try and practice loads. You should be able to do well in most of these questions. There is no reason why you should not be able to do it. So understand the element of the argument, read the question, the passage, and the answer options. Try not to let a lot of data throw you off. Make sure you can focus on the important bits and just answer the question. That is what is going to give you the mark. Reading the passage is not going to give you the mark. Answering the correct answer is the one that is going to give you the mark. It is an MCQ at the end of the day. Finding shortcuts will take you to problem solving. Find a strategy that works for you. Here's a question. In order to qualify for a bonus, employees must fulfill certain criteria. So there is £1,000 bonus and there's a £500 bonus. The question says workers performed as follows. So we've got 5 people there on the top, and then on the other side, you've got attendance in percentage, you've got some production target percentage, and you've got product accepted percentage. So the question is, who qualifies for the bonus? And the options are nobody, Smith, Patel, and Smith. 3 options, 4 options, right? So what you need to do is you need to now go back and read the table again. You need to then look at the second table and try and see if it works. So who qualifies for a bonus? Now it doesn't say which bonus, so try and go for the smaller one because any bonus is bonus. So to qualify for a bonus, you need to have absences of less than 10%. That, in other words, means you need to have an attendance of 91% to 100%. Right next to that line, 91 to 100 is required. Production targets met. Production targets met means that, in other words, you need to be in positive or 0. You cannot be in negative of the production target. Rejects are less than 8% of the output. Well, that means product accepted has to be 93 and above. So look at each of those sections. Jones has an attendance of 90, so he's off because it has to be between 91 and 100. The overproduction target cannot be negative, so McKay is off. Product accepted, remember, has to be 93 and above, which qualifies for all of them. So Jones and McKay will not qualify. All the other 3 will qualify, and therefore D is the answer. So this was a way to do this, but remember you had 2 minutes to answer that question, and I think it's doable. So D is the answer here. Finding procedures. 3 thermometers are each accurate to within 2 degrees above or below the temperature they are actually read. One reads 7 degrees, the other reads 9, and the third one reads 10 degrees. Remember, 2 degrees above or below. So that means 7% could be 5 to 9, 9 could be 7 to 11, and 10 could be 8 to 12. What is the minimum range in the 2 temperature lies? Range stands for the maximum value, take away the minimum value. But the answer they are expecting is the minimum range. Minimum range means that the top number should be the smallest possible, and the bottom number should be the maximum possible to give you the smallest difference amongst them. Now, if you have interpreted this in your head, you should be able to answer it. So look at the biggest number is 10, but you should try and pick up the smallest possible number that 10 can give you. Well, that can give you an 8. And look at the bottom number, it's 7. What is the maximum number that 7 can give you? It's a 9. So the range that it can lie under is 8 to 9. 8 from the 10 actually, and 9 from the 7. So it's option number D, I think. And that is the right answer. Are you with me? So if you understand your concepts of upper limits and lower bounding, and you know what range stands for, and you know what a minimum range stands for, you should be able to answer the question. Identifying similarity, it's a difficult question. I'll skip this. I won't go into as much detail, but this is an example of a question which is quite hard and requires a lot of knowledge. So if I was you, I would make a quick guess at this answer and move on and come back to it if I have time at the end. Correct answer is E in this scenario. Right, critical thinking. So remember, the other 16 questions of the first section is on critical thinking. The first 16 were problem solving. So here's a passage, and then its statement says, which of the following best expresses the main conclusion of the above argument? So go back at the passage and just keep in your hand that you are just trying to assess what the conclusion is. If you keep your head focused at that, you should be able to answer this question. Vegetarian food can be healthier than a traditional diet. Research has shown that vegetarians are less likely to suffer from heart disease and obesity than meat eaters. Concern has been expressed that vegetarians do not get enough protein in their diet, but it has been demonstrated that by selecting foods carefully, vegetarians are able to amply meet their needs in this respect. What is the main conclusion? Well, I think it's all talking about how vegetarian is the best diet. Let's look at option A. So I've made a statement in my head just to think what this passage means. A vegetarian diet can be better for health than traditional diet. I think that is true. I think that is exactly what the passage just said. B, adequate protein is available. It did talk about protein, but that was not the main conclusion. A traditional diet is very high in protein. Okay, fair enough, but that was not the main conclusion. A balanced diet is more important for health than any other particular food. I think that statement is true. I know that is true, but did the passage say that? I do not think the passage said that. Vegetarians are unlikely to suffer from heart disease and obesity. Now, it did touch upon it, but I don't think that is the main conclusion. So the answer is A. So other critical thinking skills that will be tested is drawing a conclusion, identifying an assumption, assessing the impact of additional evidence, detecting reasoning errors, matching arguments, applying principles, etc. Right, so that was the first section, the thinking skills. The second one is the one which is completely on your GCSE science. It's on biology, chemistry, physics, and maths. You have about 27 MCQs in 30 minutes. In other words, you need to think in your head, I need to do a question a minute. And again, I think this is doable. This is something you can practice. If you did your GCSEs last year, the knowledge should be fresh in your head. As far as I know, everyone in the country does biology, chemistry, physics, and maths. It's compulsory subjects. There is no reason why you should not be able to answer these questions. I have not put any examples of these questions. You just need to open up some GCSE grade C level knowledge or aim for B and A if you are keen to try and answer some of those questions, and you should be able to do quite good at these. If you got a grade B or A, you should be able to get very good marks in this section of the MCQs. The third section. So, okay, right. So top tips, stick to the time, revise the GCSE AS, and brush up on your mental maths. Again, there's no calculator. So some of the skills I mentioned before in the UCAT section about your arithmetic skills, your percentages skills, your ratios, try and make sure you can develop your own system, and you need to do this quite quickly. The exam is usually in the winter time, if I'm not wrong, and the UCAS application deadline is usually done by then. So you need to make sure if you're going for this examination, don't go in blindly, do some preparation before you go, make sure you're good at it. This is something which can be prepared. BMAT is something you can revise. BMAT is something you can improve on. UCAT has probably less chances of improving. It's more IQ, but it's again, some sections are doable. Anyways, section 3 is the essay. So you have to write one side of A4. You will be given a choice of 3 essays, and you have to pick one of them, and you have 30 minutes to answer this question. My suggestion to you would be try and practice as much as you can. Print those A4 pages that are there on the BMAT website. Those A4 pages are the limits you get. You cannot write more, and you should certainly not write less. You should write completely the whole of that A4 page, but you should write it properly. So what will the statement say? You will be expected to explain what the statement says. You need to be able to produce a counter argument, and you need to reconcile the two sides. So identify the key terms, make sure your argument is balanced, keep it clear and concise, practice brainstorming, Be careful with spelling and grammar, and create essay skeletons. If you do these tips, I'm sure you should be okay. So here's an example for a question. It says, little knowledge is dangerous. Plato or some other philosopher once talked about how you should do thesis, antithesis, and synthesis. Try and keep those headings in your mind. So start off by defining what the statement means. Well, little knowledge is dangerous means that if you do not have the total knowledge of a certain thing, then it can do more harm than good. That is what the statement means. This could be your opening line of the essay. Then you have to explain that. Why would some people feel that little knowledge is dangerous? Try and go into the details. If you think after watching House MD that you are able to now diagnose somebody with schizophrenia, or you can now diagnose somebody with ischemic heart disease or heart failure, well, no, you can't, because you are risking your mother, father, brother, sister, whoever you're living with. And that is not a good thing. So you need to come up with some examples. And I would say to you, in GCSE English, we always used to get taught pee all over your essay. What did that mean? I used to think about peeing all over my essay. Well, it actually means point, evidence, explain. If you can come up with a point, back it up with an example, and then round it up, that is probably the best way. So give 3 arguments in favor of why somebody would agree with the statement. Then in the next paragraph, pee all over the essay, but on the other side, why is little knowledge good? Give 3 arguments, again, point, evidence, explain. And then your last paragraph will be about bringing everything together, what I said, synthesis. So say little knowledge can be dangerous at some situations, little knowledge can be good in certain situations. So here's a passage of the middle category. I'll leave it up to you to have a quick read, but it is basically talking about that middle section. Why is little knowledge dangerous? Why is little knowledge good? It has arguments in favor and against of both. If you do that, you will do quite good in your BMAT essay. So thank you very much. Keep the questions coming in the chat box. We'll try and answer them at the end of the talks. Thank you very much, Dr. Shweb.
Thank you, Rahil. It's a really great talk. And trust me, the students really like it. It may be tough for the parents, actually, a lot of attendance from the parents, but I suspect they will be with us and for the beneficiaries of the students, actually. I'm getting a very good feedback from the students.
Thank you very much.
Thank you.
Very kind of you.
And they are actually asking to arrange a separate course from you for UCAT and BMAT to help them.
I'll give my email address at the end. If anybody wants to contact me, more than happy to.
And I think you spent a lot of time to prepare this slide. Thank you very much, Rahil. Yeah. Our next talk is personal statement. Taha Bhatt will deliver this talk. Thank you, Taha. You can share your screen.
Thank you, Dr. Shahib. I'll just share my screen now. Can you see that, Dr. Shahib?
Yes, Taha, we can see.
Okay, great. So yeah, we'll be discussing through personal statement. And as well, if you guys have any questions as well that you want to ask as well, you can ask here, but also on my Instagram email as well. And I've also got a YouTube video on personal statement and also tips on that as well. So before we get into sort of the tips on personal statement, I'm just going to be completely honest with you guys, keep it 100 and say different universities look at your personal statement differently. What I mean by that is that there might be some medical schools that go to the extent of printing out your personal statement and taking it to your interview, and they will grill you with it in the interview. Say if in your personal statement you might have written about how you've read a certain book, they will ask you about that certain book. They will test you on that, and they'll really it'll feel like an interrogation. Whereas there's other medical schools where you will go through the whole interview process and the application process, and you'll think, have they actually looked at my personal statement? So they look at it differently. But having said that, I think it's really important to still make a good personal statement, not only because you'll be able to use your personal statement as reference for your interview and when you're preparing for your interview answers, but also as well, you just don't want to take that chance. You don't want the medical school to look at your personal statement, and if you've not put enough effort in it, then you don't want that to damage your chances of getting in. So it's still really important to make a good personal statement. So what is an actual personal statement? Well, it's a piece of writing to show off your understanding of a doctor and its roles and their skills and attributes, how you have developed those skills that you've talked about, how you have shown your commitment to studying medicine. Now, You might have noticed that I put a lot of emphasis on the you. Well, that's because this is a personal statement. This is about you. You can't just get your brother's personal statement or your sister's personal statement from a few years back and then hand that in. Not only because of plagiarism reasons, which we'll talk about later, but also because the medical schools really want you to talk about and you to write about yourself, including personal experiences and specific personal experiences and doing a work experience or in your life. That's what's going to make your personal statement a lot more genuine and a lot more credible as well, which is really going to impress the medical schools. And another thing as well, for your personal statement, you need to show off. Guys, you can't, I remember my mentor saying this as well to me at school when I was making my personal statement. I was very reluctant to sort of show myself off and to sell myself because I was thinking, I need to be humble. I don't want to come across as arrogant. There is a fine line between being arrogant and selling yourself. Medicine is far too competitive for you to just hold back and not to really show yourself as an amazing person. Your personal statement is an amazing opportunity to really show these medical schools how amazing you guys really are. So you can't hold back in that regard. Of course, don't come across as arrogant or boastful, but you really need to, sort of sell yourself, list your, great achievements, and, just tell them how amazing you guys really are, because you guys really are amazing. You need to sell yourself in that regard. Some key facts as well about personal statement. So first one being the deadline for medicine and dentistry as well actually is 15th of October. So in terms of when you'll actually hand in your personal statement, if you're going through the sort of traditional undergrad route, then it's going to be at the start of your year 13 year, so 15th of October, which is earlier than other courses when other courses expect their applicants to hand in their personal statement. But don't be disheartened. It's better that you get this personal statement done this early, because then you can focus on your A-levels, your UCAT, your BMAT, your interviews as well. So it's actually a good thing that it's quite early. The character limit is 4,000, meaning you have to be concise when writing your personal statement. Now, what does concise mean? It means to say a lot with very few words. So it's sort of a skill that you have to sort of develop when writing your personal statement. And we'll go through it later, but I'd really advise showing your personal statement to English teachers as well, because they'll have this really good skill of being concise, saying a lot with very few words, because you've only got a 4,000 character limit. So it's really important to keep that in mind. And UCAS is the website you're going to have to send your personal statement and application through. So I'd really recommend visiting UCAS as well. Not only because you can sort of familiarize yourself with the site that you're going to apply through, but also it has some tips as well actually on personal statement and what exactly the universities are looking for on your personal statement as well. So it's got some good, more information on that website as well. So great things to write about in your personal statement. I think this is like common ask you question, people always ask, what should I do or what should I write about on my personal statement? And if you're in year 11, or year 12 or younger, you really need to pay attention to this list, because you've got so much time and you've got the time to start being able to build up on these things. Because if you do these things I'm about to show, then when it comes to writing your personal statement, you'll have so many things to write about. So it's really important. So that's a list of things you can do to help strengthen your personal statement. So Fatima actually talked about this earlier with the Duke of Edinburgh and NCS. Employment. So, don't take this list as a must, that you must do each of these things. I didn't work myself because I thought it would affect my A-levels performance. So, but if you do work, then that's something to talk about in your personal statement. And don't think that has to be medicine related. Guys, like with your personal statement, this is where you need to develop this skill of, again, selling yourself. And, for example, if you work as a waiter and waitress, you might not think that's relevant, but that is so relevant for your personal statement, because you can talk about how you dealt with angry customers or how you're able to develop your communication skills through talking to people. And then you can translate that back into what you saw in your work experience and how the doctor showed good communication skills and its importance in medicine. Volunteering is really good to talk about in your work experience. Hobbies as well, interests. They want to know about you. Again, stuff like that is going to make it just more personal and more genuine as well, which is something that's going to impress the university as well. And personal experiences. So what do I mean by that? Well, for example, for me in my personal statement, I wrote about how I was involved in a hospital incident, and other people have written about their hospital incidents, or maybe perhaps a family member was involved in a hospital incident. And as long as you're comfortable writing about it, then it can be good to just sort of write about it to show how your interest of medicine first started. But guys, if there's one thing you take out of my personal statement talk, it's this next thing. This is the most important thing, okay? It's not about what you have done, it's about how you can reflect upon these experiences. Okay, if I go back to this list, it's fine and dandy that, you know, you've done 1 week of work experience at a hospital, and you might talk about how you saw a heart surgery or something amazing like that. That's amazing. But the university, the medical schools, they really want to know your reflections. What did you actually learn from your work experience? What did you actually, how did you feel? How did you react? So for example, you know, you need to talk about on your work experience, you saw how the doctor deal with, be specific as well. So you can say, without giving away patient details, you can say you saw how a doctor dealt with a patient with dementia and their family member, and you saw how using their communication skills and their use of eye contact and tone, they were able to reassure the patient and their family and sort of explore their ideas, concerns, expectations, which made the patient feel a lot better. And so, yeah, that sort of reflection is so important. They want to know your understanding of the doctor's role and know your understanding and your insight into what sort of skills and attributes a doctor must have. So that reflection part is really important for your personal statement as well. And this is sort of just a rough sort of guide on how to structure your personal statement. Don't take this as sort of like concrete structure. I think the most important part, guys, is the introduction and the conclusion. All the stuff in between, I mean, you don't have to use the second paragraph as work experience, but definitely include work experience there. But if we just start at the introduction, your introduction of your personal statement should be sort of a short paragraph on why you want to study medicine, sort of your motivation to study medicine. And in fact, in my interviews, actually, I just used my first paragraph of my personal statement as my why medicine answer. People often include some sort of eye-catching quote here at the beginning, or, you know, for example, myself personally, I talked about my hospital incident here in the introduction, just to sort of catch the attention's reader, because you got to imagine as well, like, the examiner or the administration officer, he's going to be reading through, or they're going to be reading through all these personal statements. You want to include something eye-catching at the start as well to sort of grab their attention. And then in between your introduction and conclusion, you can talk about all these things you've done, work experience, volunteering, DofE Edinburgh, and remember, reflection. Reading journals, so like any sort of reading you may have done, it's good actually, because it shows sort of your commitment to learning as well. So it's a good idea. Just remember, do not lie on your personal statement. So if you said you've read a book, please read it. Don't just do that, because you'll turn up to the interview and you never know. They might pull that book in front of you and then you'll have a heart attack there. So don't do that. Don't lie on your personal statement. And then in your conclusion, just give sort of a summary of what you've talked about in the personal statement. And something that I'm not sure that gets mentioned actually a lot in terms of the tips for personal statement, but show enthusiasm. I mean, medical schools, and you show enthusiasm throughout your personal statement, not just your conclusion as well. But this is so important. Medical schools, they want someone to actually, they want an applicant who actually wants to study medicine, who has that passion, that drive to study medicine. Medicine is 5 long years. They don't want someone who's just being pushed into study medicine. So you need to really portray your sort of enthusiasm through your personal statement and interview. So you can do that in your personal statement through just even saying the phrases like I was fascinated when talking about something, or, you know, I thoroughly enjoyed, or I loved. These certain words can really portray your enthusiasm, which is really important, because it's going to make sure to tell them like, I actually really want to study medicine, which is really important. And last sort of tip, so as I said as well, plagiarism. So plagiarism basically means copying someone else's work and playing it off as that it's your own. So taking sort of ownership when it's not yours. So for example, you can't just copy and paste off Google and say that you wrote it. You can't just, you know, use your brother or sister's old personal statement, hand that in and say you wrote it. universities take it very seriously. In fact, it's not a joking matter, because even I can say as a medical student, they take it so seriously, and they really are they'll basically punish you quite severely at medical school if they catch you plagiarizing or copying. UCAS will catch you, so they actually have some sort of program where they will scan your personal statement through, and it will it'll measure your percentage of plagiarism, because you can't really have a personal statement that's fully unique. It'll use some sort of phrases from somewhere else, but as long as it doesn't hit a specific threshold or it doesn't go over, then you're fine. But yeah, as long as you just don't copy and paste off the internet, like full personal statements, or you don't use a personal statement from a few years in the past and just hand that in, then you should be safe. Again, we've talked about reflection, reflect. We've talked about that before. Show yourself off. Just a bit more about this, guys, as well. I think, there's some students who think, I can't really talk about certain stuff. It's not impressive enough. You can spin stuff off to be really impressive. For example, say you played for your school football team and you might have played, 2 games, and you might have not been that good, but you can spin that off in your personal statement and interviews, and you can say, I represented my school football team in numerous tournaments and numerous games where I was able to develop my teamwork skills through giving instructions to my teammates and listening to them as well. As well as that, I also made sure to contribute to the team's work. And then you would then later talk about and write about how that translates to why teamwork is important for doctors as well, and in a hostile environment. So again, you might have been some rubbish like football player, but that doesn't matter. As long as you're not lying, you can still sell yourself and spin it off in a way to make yourself sound amazing. So that's really important, the ability to show yourself off and sell yourself. Draft. So again, this isn't going to be something where you write once and then that's, khalas, is done. No, you need to draft. Your first draft is probably going to be very bad, but that's why it's so important to show your personal statement to your English teachers, to your mentors, to medical students as well, and then get feedback from that. And they will tell you some, you can take these things out, you don't have to include this, and help you to shorten it and help you to make it better. And especially English teachers, guys, as well. You guys need to use the resources around you, especially if you're at school, because articulacy, how well or how good your personal statement sounds, like the grammar and the sort of the adjectives you use as well, that's really important as well. I remember my mentor said when I was writing my personal statement, she said to all of us, all of you are banned from using the word good. She said, you're not, if I find the word good in your personal statement, I will slap you. Okay, so she said that because it's so important to be articulate in your personal statement. There's so many better words than good. Even stuff like the use of openers, like moreover or although, in addition, to add. These might sound little, but they can add to your personal statement a lot. And bring a notebook to work experience and volunteering. So I think Fatima might have touched on this as well before. But basically, when you come to writing your personal statement, you don't want to be stuck on what to write about. You don't want to think, oh, what did I see on my work experience? What did I do on my volunteering? That's why it's important to your work experience and to all these other sort of first aid events that you might have attended or volunteering. Bring a notebook and write anything down that you learned or anything that you saw. Just make sure you're not breaking confidentiality, meaning you're not giving away patient details such as their name or where they live. But as long as you're maintaining patient confidentiality, then it can be a really useful resource for you to have when you come to writing your personal statement. So you don't have to try and get memories from the back of your head. You've got sort of a resource in front of you. So that's, I think, my last tip. So thank you very much.
Thanks, Taha. It's such an enthusiastic talk. I really like it. Now, our last talk is on selection of universities, and it's a combined talk will be given by Ehsan and Rahil. Ehsan, you can start first and give your thoughts, and then Rahil will join you. And Ehsan, can we share the feedback link form now, please?
Sure, I'll do that now.
After filling the feedback form, you will get a certificate.
Right. Thank you, Dr. Shoaib. So, imagine yourself in this room. You've got 5 chairs in front of you, and on these chairs, you've got candidates sitting. So this time, the candidate is not you, but the university that you want to go, that you want to put on your UCAS form. So there are 130 universities in UK, of which there are 37 medical schools spread, as you can see in this map. Why is it important? You will be spending, as Taha mentioned, 5 to 6 years of your life at this place. It may shape your future career and possibly the place where you will find your future partner. You will make lifelong friends. You may decide to work here for the rest of your life. You will definitely have a connection to this place through using alumni network, for example. There are mainly 3 different types of medical schools according to their course structure: traditional, integrated, and problem-based learning. So the traditional medical course, in the first 2 years, you will be focusing on learning in a more traditional lecture setting, where the emphasis will be on science-based theory across all medicine. You will cover physiology, biochemistry, and anatomy. There will be plenty of lectures and courses for you to complete. After that, in years 3 to 5, you will be taught in more clinical settings under a named consultant or a senior registrar. You will take part in ward rounds, do shadowing, or may even go to GP placements. And there will be some tutorials, seminars, and lectures at this stage as well, but more focus will be on working in practical hands-on situations. It is suitable for students who prefer to have a greater knowledge base before they embark on their practical studies. The advantages are that by the end of the first 2 years, you will have increased your medical knowledge hugely, and this will lead to increase in your confidence before you start your clinical placements. It is still amongst the most popular course types in the UK and is taught at almost all the academically oriented universities, such as Oxford and Cambridge. The second type is the integrated medical course. It is similar in some aspects to the traditional courses, with one key difference. You will start some clinical work experience from day 1. It is now the joint most popular course alongside traditional. It is viewed as more adaptable to modern medicine. It quickly acclimatizes students to working life in clinical settings. The key difference from traditional medical course is that scientific theory is taught by topic rather than by discipline. So what you'll do is, so you will take up, for example, the cardiovascular system. You will learn about the biochemistry, the physiology, the anatomy, in systems-based, rather than learn about anatomy of all the different organs, and then you learn about the physiology of all the different organs. And it is now the recommended approach according to the General Medical Council, which obviously gives us licenses to practice as doctors. The advantages of integrated medical course is that it will gradually grow, you will gradually grow more comfortable in the clinical settings rather than being expected to be able to apply 2 years of knowledge readily in high pressure settings. This can be quite intimidating for some students. Conversely, for some, immediate patient encounter in a clinical setting may seem daunting, and you may feel like you won't be prepared to face patients in your first year. Now, you won't be going straight on your first day, probably in your end of your first month at university. It's not sort of straight on the first day. It's important to bear that in mind. However, most of the integrated courses don't, obviously, as I've said, don't throw down the corner immediately in your first week or month, but they gradually introduce you via group work. An example of this is University of Leeds. The last type of medical course is the problem-based learning. It focuses on small group work, peer-to-peer learning methods, and a high emphasis on education through problem solving. It is available from a small number of universities, although these are growing in number now. It is shown to be the modern method of learning, which focuses on solving problems using initiative and proactivity. It aims to teach similar fundamental information as a traditional lecture-based approach, but in a context that enables students to delve into more detail over the realistic application of such knowledge in hypothetical situations. So the students will work in a group of around 8 to 10 alongside an experienced tutor, and will be asked to investigate hypothetical situations. They will be asked to go away, read up on a particular scenario, and then come back and give their input in terms of how what sort of investigations should take place, and how that particular patient in that hypothetical scenario should be managed. The advantages are that it will help promote teamwork. So you divide and you take certain aspects of the case. So not everybody doing the same thing. And that obviously provides a multidisciplinary approach, which is so important in modern NHS training. It will help students engage with the healthcare service rather than with the underlying scientific theory, which underpins medicine. The PBL time courses all have slightly different flavors, so it's always worth checking your prospective university's curriculum very carefully. An example of a university that offers PBL is University of Manchester. A word on dissection. Now, this is a very common question asked by prospective medical students about what dissection certain universities offer and what you should do. So my advice is that you should do your research. Universities such as Leeds, UCL still offer full body dissection in the first 2 years. I went to Leeds and we had a full body dissection. Essentially, you had a body where you will start from head to toe, from outside to inside, dissecting away, learning about the different nerves that control the muscles and the muscles that are on the bone and how they connect with tendons, for example. Now, there are obviously other universities such as Oxford, Liverpool, Southampton, I believe Newcastle as well, and Exeter, which offer cross sections, which essentially means you'll have a shoulder, for example, a human shoulder sample given to you, and you'll be with all the attached muscles and nerves. You have to obviously, you go through them and learn. And some universities are also using computer models now, in addition to cross sections or dissections, to allow you to have 3D essentially of a human body, where you can rotate and you can view through different slices. So my advice is medical school should suit you. You will be spending at least 5 to 6 years of your life there. Do your research and think carefully about what sort of courses will suit you better. Everybody is different, and therefore you may excel in a particular type of medical course, whereas your friend may excel in a different course. At the end of the day, all of you will come out as a competent doctor, ready to help fellow human beings, because after all, that is why you're doing medicine, right? Last but by no means least, a very good luck to all of you. These are some of the helpful resources. I'll share them in the chat box as well. And this will be followed on by Rahil's slides now.
Rahil, have you unmuted yourself?
Can you hear me?
Yeah, we can hear you now. Good.
Great, thank you.
Good.
So yes, thank you very much, Essen, for that wonderful talk. So Essen has gone over the ideal scenario whereby you are deciding what type of course you like, which city you want to live in, and what university you want to study in. But I wish life was as easy as that, because in the real world scenario, there is problems. In the real world scenario, there is not always a happy life. So what do universities really look at when they are trying to choose the candidates to study in medical school? There's 5 things that we've touched upon today. It's the GCSEs and A-levels, personal statement, UCAT and BMAT, and interview. And the different universities look at these in different ways. And you really, really need to know what those things are. What are those entry requirements that each university look at before you apply to them? We'll touch upon some of the widening participation schemes as well. So in the real world scenario, what advice I would give you is, if you desperately and really want to be a doctor, you should really think in your head that I need to get into a medical school. You just need that one offer. You don't need 4, you don't need 3, you don't need 2. You just need that one offer to get into a medical school. Ideally, if it is in the place that you want to do, then that's brilliant. But every university, all 37 of them, will make you a doctor. And to be honest with you, it is great that if you want to study in Oxford, Cambridge, and all these big universities, that is fantastic. But a word of caution: when you graduate and you become a doctor, in your F1 and F2 application, the very first thing that used to sort of give you marks, and I'm not sure if this is still the case, but I still think it is, the first thing they look at is where did you rank amongst your peers in that university? So if you go to a university whereby some of the lesser candidates, if you permit me and allow me to say that, went to medical school too, you probably would end up in the first decile and would score the highest. So point I'm trying to make is all of these universities will make you become a doctor. All of these universities will help you get an F1, F2 job. Certainly there has not been any medical school, any graduate who's not been able to get an F1 job. So your priority should be in the real world scenario to get into medical school. And the way to do that is you need to go at those universities' entry requirements page and look at whether you meet those entrance requirements. If you do not meet those entrance requirements, do not apply to them. Because if you apply to them and you do not meet the entrance requirements, you will not get an interview. And that's one of your options wasted. So play to your strength. Here's an example. I studied at Newcastle University, and the current Newcastle guidelines stay in the entrance requirement page, and this is taken directly, copied, pasted from them, that in your UCAT score, interviews are awarded based solely on the UCAT once academic threshold is met. If SJT band is 4, which means it's the worst possible score you can get in the SJT, then you will not be invited to the interview. And the UCAT cutoff score is a maximum score of 2,730 in 2020. This changes every year. But roughly what we're trying to say is if you got a score over 700 in UCAT, then I think you are probably in a strong position to apply to Newcastle. If you've got a score over 800, definitely apply to Newcastle. You will probably definitely get an interview. Personal statement is not used. GCSEs is not used. A-levels, you need 3 A's at A-levels. In other words, if you're predicted 3 A's after A's, you should be able to get an interview if you meet the UCAT deadline. So here's what I'm trying to say to you, that if you get a UCAT score of, say, for example, 2,400 or 2,350, and you've now just read this, please do not apply to Newcastle because you will waste your option. No matter how much you want to study in Newcastle, no matter how much you love the integrated system of the Newcastle Medical School that Essen has so enthusiastically talked about, you will not be given an interview. So do not waste it. Go somewhere else where you will meet the entrance requirements. In other words, if you meet the GCSEs, the A-levels, the personal statement requirement, and you've got a decent enough UCAT score, which that university looks at, then apply to that. The widening participation is also an excellent scheme, which is aimed at students applying from sort of lower socioeconomic developed areas from their schools. And all you have to do is you need to apply through a UCAS, and your A-level criteria will be lowered. All you have to do is then enter into a summer school, which you do at the end of A2, and you should be able to get into medical school through there. One of the other things that I would encourage you to do that is there are some 6-year courses out there as well. So if you think you will not do particularly well in A-levels and you are from one of the schools or colleges whereby it's in a certain demographic area, then you should be able to get into medical school through the 6-year courses. One of them, for example, is called the Hull York Medical School Gateway Pathway, where the A-level requirement is a B, and a C. And the GCSEs can be just 5 Cs. And the admission test UCAT is much lower in scale. So all you have to do is you have to be age 17 and above, not from a private school, and you have to meet 2 of the requirements, which is your postcode is in a certain area. If your parents did not have a higher qualification and you, for example, received a UCAT bursary, if you've got 2 of those 3, you should be able to apply to this as well. So think through different things properly. Make sure that the universities you want to apply to, you can see their entrance requirements and play to your strengths. That's the guidance I would give you. Thank you. Best of luck. Here's my email address. If anyone wants the slides for the UCAT and the BMAT talks or want any further sort of guidance, just email me. It's not a problem at all. I should be more than happy to help you. Thank you very much.
Thank you very much, Rahil. And now our last session about question and answers. Essen will lead this session. But first of all, I'd like to explain it's a huge audience and it's not possible to cover all the questions. Essen will summarize the important question and then answer which helpful everyone. Essen.
So thank you very much, Dr. Shoaib. So let's just start from the very beginning. First of all, there's a question about how do you register. So the feedback link that I have shared, and we'll share it again, it will allow you to essentially register. So that's sorted, that's taken care of. Let's just go from the questions in the time order. So there's a question from Hamza Wahid. Please, could you kindly give some tips, advice for the VR section of the UCAT exam? I believe Raheel has covered that in his talk, and I hope that satisfies you. If you have any questions, Raheel will share his email address so you can ask him directly. So the next question is, so there are a few questions from Syed Asghar Hussain. How are the private universities in UK? So I would like to, but in my opinion, I do not have any experience of private universities. When I went to medicine in 2008, at that time there were very few. So I'm not sure whether any of my other colleagues in the panel can answer this question. I'll try and so Taha and Fatima, if you have any ideas about the private universities.
Not myself personally, no.
Obviously, they've become an option in the recent years, and I would recommend go on the websites and look for the requirements. But from what I understand, I think the requirements can be a bit low to get into a private university. But at the end of the day, you still come out with a degree, but obviously you pay for it a lot more than you would with applying to a normal university. So just go on the website and look up the requirements. And if you go in student room as well, I'm sure you can find medical students that attend that university who can help you out and tell you a little bit more about the course.
Okay, thank you for that, both. So there are quite a few questions. I think it would probably be best in the interest of time that we email you separately to answer these. Does anyone know about the UKMLA exam from the panel? There's a question about details about the UKMLA exam.
What I know about it is that obviously before you registered for the DMC just by passing your university exam in your 5th year, but now in order to become a doctor in the UK, I think for the year above me, so I don't think Taha will have to go through it, but people who are going into their 3rd year now, they'll actually have to do this exam, which is similar to an exam that overseas students do as well in order to register in the UK. So everyone has to do it, but they haven't really shared any details about it. I think there's a MCQ part and then there's a clinical bit, but you'll learn more about it when you actually get to university.
Sure. There is one other question about GMC registration for non-EU international students. Now, obviously, this is not what was catered in our talk. So I'll briefly say, so for those, there's a PLAB examination that you have to do, and there's a criteria for that, and there's plenty of resources available online for that. The rest of your questions, we would reply to you in an email, if you can provide us with your email, Syed Asghar. So moving on. So there's a question from Siraj. What qualities are required to be demonstrated by the student at interview? Taha, do you want to start first?
Yeah, I will intervene here. We are arranging a separate course on the interview probably in October, and I think so Jamal will deliver a talk on this. It's a great topic. It's a great question, but I think so it demands a separate course.
Yeah, you can go through. Yeah. Absolutely, and we'll go through mock interview questions as well, so give you a good roundup in terms of that.
It will be a comprehensive course for those particularly only who want to apply for interview, who are going for interview actually.
Absolutely. I think one tip I would give for interview, what serves me well to this date, is just be yourself, be very calm, be relaxed, because that's when you perform to your optimum. If you're stressed about it, it will show up. That was my advice. I went to my Leeds medical school interview, and that Leeds was my first choice. Really calm. Actually, I was playing games on my mobile phone. So I had no, I just went in there and I really enjoyed the interview. And I think that's the aim. You should enjoy it. I don't know if Taha, Fatima, and Raheel want to add anything to this.
Yeah, I definitely agree. Like, I think the first interview, I remember I was very, very nervous. Like I could feel the pulse in my head, but by the other ones, you do definitely enjoy the process, and just smile as well. I think the interviewer within the first few seconds, they'll be able to tell this guy's really nervous, this guy's overconfident, this guy, so just the first few seconds, your first impression, just make a really good first impression, I think.
Yeah, and just to add to that, if you prepare well for your interviews, there would be no reason to be nervous, and they really want to see your real personality. They don't expect you to know everything there is to be about a doctor. Is that you've done your research and you really want to study medicine. That's all they want to see.
Raheel?
Yeah, I completely agree. Okay,
brilliant. So there's a few questions on the recording of this webinar. So it will be hopefully uploaded on our APC UK YouTube channel. I have sent a link to some individuals. I'll be happy to share it with the rest of the group, and it will be available there. Unfortunately, due to logistic reasons, we're not able to email it to everybody. So there will be an APC UK. There's an APC UK YouTube page on which this recording will be uploaded in the next few days, 2 week time.
As it may be possible, we can send through Eventbrite. It may be possible. I will try it. It may be
Okay.
possible. We will send a link to Eventbrite if
Brilliant.
it's still valid. Yeah.
Okay, fine. The next question is, what is IB? Who wants to go with this? Taha, Fatma?
I think someone answered it in the chat. I think I've got no idea what it is, to be fair, but I think someone answered it.
Yeah, it's
Mine-
just another alternative to A levels, I think.
Yeah, international baccalaureate. I think it's tested in certain cities like London, etc. I'm not sure of the exact details, but obviously it's equivalent of A levels, and they have their own entrance requirements. You just need to go to the website and check what they are.
Yeah, perfect. So moving on. Okay, so a question about what GCSE results are needed to get into Oxford and Cambridge. I have shared some links in the group for you to go on to. There's a question about from Zainab, depends on, sorry, actually that's an answer to a question. So there's a question by Fawaz Hussain, are biology, chemistry, maths, and economics good choices? My answer to that would be, if you enjoy them, then yes, they are good choices. Actually, it's a good combination anyway. Any comments from the other panel members?
I think,
Yeah.
yeah, you go ahead, Rohit.
Yes, completely agree. Try and definitely keep biology and chemistry, and choose any of the third subjects which you enjoy. It can even be English or art, whatever makes you happy.
Yeah, second that. I took biology, chemistry, and maths. I really liked maths up until year 13, year 12. I hated it then. So just keep that in mind. Like, I would pick a third subject where you're confident you can get an A in, because at the end of the day, biology, chemistry, they're monster subjects. So don't, make your life too difficult, basically.
The next question is from Amna Khawaja. Is there any benefit to taking both maths and further maths if you already take biology, physics, and chemistry? As I said in my talk, you should only choose one, because the universities will not accept maths and further maths as individual subjects for whatever reason. I don't know if anyone else wants to add anything to that. So moving on.
Yeah, that is fine. Some universities don't look at further maths, but I would say to you that it does look good on your sort of application in some universities. I do remember my interview at Cambridge University. The first thing they asked me was, you do further maths, here is a question, can you differentiate this graph right in front of us? So I mean, it can lead to conversations.
Absolutely. And I think if you like maths, you are going to like further maths, and you will get an easy A in that as well. So there's no harm. Right. So the question about UCL scheme, I've sent a link, and it's similar to what Raheez mentioned about the access scheme for the Hull York Medical School. And then I'm just going on. There was some personal question that I will try and share as well for the benefit of everyone. So just wondering if English, okay, so there was a question about whether English at higher level in Scotland is necessary for medicine. So based on my research, most universities in Scotland do require an English at higher level, which is equivalent to GCSEs. So yes. Moving on. So there was a question, a very good question about doing a Duke of Edinburgh Award and doing bronze, and whether we would recommend that you do go further for silver, etc., or gold. But you're in your sort of second year of your A levels, and you need to prioritize whether you should do volunteering or go for Duke of Edinburgh. My opinion would be the more variety you have, the more you can demonstrate in your personal statement, the better. So I would say probably try, and obviously if you can get silver or gold in Duke of Edinburgh, go for it. But I don't know what Taha and Fatma would like to add to this.
Yeah, for sure, I think a silver looks better than bronze because it takes longer to complete it. But did you say that she was in year 13 now, second year of it?
Yeah, 12 actually.
Year 12, yeah, then there's time to complete it. If you're in year 12, there's plenty of time. But if you're in year 13, you remember you have your UCAT, you have your PERSA statement. If you're doing your BMAT as well, then you have to prepare for interviews. There's no time. And at the end of the day, you also have those A levels. If you're not going to get those 3 A's, doesn't matter if you've done a silver or not, you're not going to get in. So just prioritize. And if you have time, then do it. But bronze should be good enough as well. But if you can do silver, then that'd be really good as well.
Taha?
Yeah, I agree. Yeah, it's more about like reflecting on the experience. Like, I don't know if it's the actual award itself, but in my interviews, I constantly talked about Duke of Edinburgh World Challenge. So, and even some of my friends, they didn't actually fully complete their Duke of Edinburgh. They said, I'm in the process of this and I've managed to develop these skills so far. So, yeah.
Okay, so the next question was whether there is a difference in getting admission to a medical school from a private versus grammar versus a state school. And recently there have been rumors about students being low on the priority list if their parent is a doctor. Can we have some clarification? Now, my reply was there isn't a difference from what I know, whichever school you've come from, so long as you've got the grades that you can demonstrate. And secondly, I think it's just a myth that if your parent is a doctor, then you're on a low priority. I think if anything, it gives you an advantage because you know the realistic life of a doctor. So I think it's just a rumor. Okay. So the next question was, okay. How much does GCSE count in the overall results in admission to a medical school? So I think it varies from university to university. And some universities, they matter more, and other universities, they don't even look at them, such as Raheel mentioned, Newcastle. Anything the panel wants to add to this?
Yeah, it definitely depends on the university you're applying for. For example, I think Cardiff, they look at GCSEs. So if you've not got a really good UCAT score, that's a really good place to apply. Or if you've got a mixture of a decent UCAT score and good GCSEs, then Birmingham's a good option because they look at both. So really just do your research and look at the universities that you want to apply to.
Okay. The next question I think is also for you, Fatima. So this person has done the personal statement, well done, got a good mark in the UCAT exam and have sufficient A level and GCSEs for Birmingham University. And just wanting to get some tips and advice for Birmingham and in your experience in terms of interviews and the application process.
So if everything is there and they have the required entry requirements, then Birmingham is a really good choice to apply. The only thing I would say is if you go on the University of Birmingham site, there's an offer calculator. So you can put in your UCAT score and your GCSE scores and see if you are likely to get an interview or not. That may give you an indication of what your chances are, because each year the entry requirements, people do better on the UCAT, then it gets harder to get in. Other than that, about interview, I think Birmingham has a really good interview process. It's MMI, so it's a lot of different stations. So if you mess up on one station, that doesn't matter. You can do better in the other station. And yeah, I think it's the interview process is the same as any other university. So if you want to apply to it, then just check that offer calculator and just have some reassurance that there is a chance of getting in. Because if not, they will tell you that based on last year's results, you're not that likely to get an interview.
All right. Thank you. Is it all right if I just ask one more quick question?
Sure.
Yeah, so I've heard basically like this year the competition is just going to be more high because of like deferred entries and gap years. So I was just wondering, because I've heard a lot of people say that even with like a very high UCAT score, 3,000 and good A levels and GCSEs, that they're still not getting in, and then they're telling them like, you know, to go to a faraway university and you get an incentive like £10,000 or something. I'm just like, do you know what that's about? Like, what's actually happening like this year around? Because I'm going to apply. So I'm applying this year for a place next year. So would you have any tips in terms of that? Have they set the bar more high? Is what I'm asking.
Yeah, so because of COVID and the A-level fiasco that happened last year, they're definitely a little bit more competitive to get in this year. That is true. However, that shouldn't discourage you to apply. If you're a good candidate, then you're as good enough as anyone else and you have an equal chance of getting in. Just be really smart about the universities that you're applying to and really look back on your GCSEs, grades that you got and your UCAT and see which universities you have a higher chance of getting into. Some universities on the website as well, they'll let you know what the threshold was like for last year. So that could give you an idea as well. And as far as where deferred entries go, I feel that a lot of people from my year who didn't go in deferred for this year. So I think you should be okay because you're the third year, I think, applying
Right.
from COVID.
So should I do anything different? Because I'm pretty much done with everything now, and now interview is my last hurdle. Would you say, to stand out more? Should I, get another job? Should I have more to talk about in an interview?
If you've already applied, then you're going to get called on an interview based on your UCAT score or your GCSEs or your personal statement. So if you do get an interview, then yeah, keep working on preparing for it and reading a lot around the internet and doing exam prep so that you really stand out then. Now, I think it's a bit out of hand now, like what can you do to get an interview in the first place? If you do get it, then it's fine, yeah.
Right. Okay, thank you very much. I'm going to apply this year round. So I'm going to apply, I think the deadline's October. And I'm already doing like a lot of reading, BMJ, and I've done another BTEC as well. So I've already got a lot, but I guess like maybe another job would add more.
Yeah, remember, it's all about reflection, which is what Taha has said. It doesn't matter if you've done 5 placements or 5 jobs, or if you're only done 2. It depends on your experiences and what you learned from it.
So I think in the interest of time, we'll just move on. So all the very best to you. So there's a question by, how do you study 5+ years of medicine without burnout? I think that's a very interesting and an excellent question. I think for me, if you love something, then you don't feel it, but it's important to be able to do other things. So when I was in medical school, I was part of the Islamic Society, and I was also part of the sports society and organized, I love football, so I played football, and so there are ways that you should do and you can do to avoid the burnout and have a great time at university. What would the other panel members add?
Taha, you need to unmute yourself, please.
Okay, sorry. Can you try now?
Yeah, we can hear you now.
Okay. Yeah, if I'm being honest, like I've felt a lot of people feel burnt out. Like myself personally, I felt burnt out second year, third year. I'll probably feel burnt out the next years as well. But I think Dr. Hassan, like he's definitely right. Like you need to find something else other than medicine. Don't let medicine take over your whole life. Me myself, I do YouTube on the side. It just gives me that extra thing that I don't have to think about medicine all the time, so it keeps me from being burnt out. Join society. If you join a society like I did Brazilian jiu-jitsu as well, martial arts, then it allows you to have different friendship groups as well, so you're not just talking about medicine the whole time. But definitely do that, and also seek support. Don't feel overwhelmed, because mental health is really important in medical school, and a lot of people suffer from poor mental health because they feel burnt out. So definitely seek support from the university and friends as well. If you isolate yourself, that's the worst thing you can do. So definitely talk about it with your fellow colleagues and seek help.
Okay, so I'll just go very quickly. So there's a question: if you get a low UCAT score, can you still get into medicine? So again, like Raheel said, play to your strengths. Depends on what university you want to apply to. There will be some universities who may actually not look at the UCAT score as much as GCSE and A levels. So go for that. There's a question about, what if I'm currently studying in USA? How do I take A levels? Not sure how to answer that. I don't know if any of the panel members have any inclination.
I'm not sure of the exact answer, but I must say that I think you would need to be an international candidate, and you need to fulfill the international entry requirements, which would be equivalent of A levels, whatever you study.
Fine. There's a few questions on UCAT, so I would encourage you guys to email Raheel directly. We'll be very happy to answer these. So I'm just going to quickly skim through, see if there's any other burning questions that we should answer. There's a question from on any advice for UK students studying outside the country. So if they're British nationals studying outside in Europe, for example, then I think when they come back, they have to go through the same as the international non-EU students, so in terms of the PLA examination. That's my knowledge. I don't know if any of the panel members know any difference.
It's better to check the GMC because its guidelines change every time. And it's better to get fresh information, in my opinion.
Yeah, I agree with that. But also remember that everyone is going to have to do UKMLA now. So before, if you were studying in the EU, then if you were part of the EU country, I don't think you had to do the PLAB then. But now everyone has to do it. So myself and yourself will all be in the same position.
So there's a question about what if you're unable to take chemistry and biology? I think chemistry is a must, and a lot of universities also want biology as well. So really, if you want to do medicine, unfortunately, you have to do both, or at least one, which is chemistry. If you do 4 A levels, should you drop one in year 13 to make it easier? Yes, I think majority of universities look for 3 A levels, so you should. Does going into grammar school increase the chance of getting to medical school? No, it depends on what grades you get. So it doesn't give you any other advantage than that. How do you get the certificate? So if you fill out the feedback link, you will get a auto-generated certificate sent to your email address that you send. Do check your junk email folders. Sometimes they end up there, but you will get a certificate as soon as you submit the feedback form. The link is being shared on the screen. I think there are quite a few questions, but I think we should wrap up now. And I think we'll try and answer these via emails. So if you can please email us. You can email, we can always give our email addresses in the chat box. And if you could email us, then we can answer you in a more comprehensive way. But I think we should wrap it up now, Dr. Shoaib.
It's fine. It's fine. And just last announcement, we will advertise our interview course soon, probably in September, and the course will be happen October or November. Those who are interested will find this information useful. Thank you, everyone. Thank you, all the participants. Thank you, speakers. Rahil, it's a great talk. Can I see your sun better now? Just a little bit up. Thank you, Fatima. Thank you, Taha and Ahsan. See you, inshallah. Jazakallah khair.
Thank you very much. Assalamu alaikum.
I'm stopping recording now.